Welcome, everybody, to the Cone of Shame Veterinary Podcast. I am your host, Dr. Andy Roark. Guys, I got a great episode for you. I am not kidding. I got something special in this episode, too. Let me fill you in real fast. This episode, I have my good friend, Dr. Ernie Ward, and he is here talking about pet obesity and having hard conversations in the exam room. And guys, this is really good. After the episode was over, I gushed to Ernie when we were done. I was just like, man, you validated so many things that I have wrestled with so hard. Like, I've never felt like I've gotten good traction when I talk to owners about pet obesity. When I've talked about things like decreased mobility or osteoarthritis or even decreased lifespans, like it never seems to resonate as much as I want it to. And also, it's awkward to open the conversation up. And Ernie was like, yeah, I know. This is what I found. This is what the research says. And he's got such a wonderful, subtle, supportive approach. And it's just, man, there's just great tools in this episode that you are going to use in the exam room. I took so much away from this. So anyway, it's a great episode. Also, guys, for the first time, we have put together a resource to go with this episode. So check out the show notes. I have got a team handout to go along with this. If you want to do a listening party, which a lot of practices will do, they'll play episodes like this. They'll listen with the whole team. We have got a handout to go along with that sort of tests and quizzes people as they go. Make sure your team stays engaged and that everybody's kind of processing what's happening. It's got discussion questions at the end. It's totally free for you, but it's just something to help you guys get more out of episodes like this. So anyway, check out the show notes, grab it. I'd love to hear how you think about it, or how useful it is in your practice. Anyway, this is a neat little project. I'm excited to try it out. I hope you guys will get a lot out of it. This episode is made possible by Hill's Pet Nutrition. Let's get into it.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. Andy Roark.
Welcome to the podcast, Dr. Ernie Ward. Thanks for being here, my friend. How are you?
Oh, man, I am great. I'm better now that I'm here with you.
Oh, you're very, very kind. I appreciate you making time to be here. I know you do so many things. For those who don't know you, you are Dr. Ernie Ward. You are a prominent speaker, writer. You write for Today's Veterinary Business. I read your column today called Opening Shots. You lecture all over the place. You are a certified veterinary food therapist. You are the person that I think about when I think about pet nutrition, obesity, weight loss, exercise, all of these sorts of things. You're such a strong advocate for pets. You are such an excellent practice management and communications lecturer. I can't say enough good stuff about you. So I am thrilled that you are here today. I want to talk to you about an area that I know you have a lot of interest in and you're passionate about. And so, I was working recently with a dog owner, and I felt a bit of frustration that I haven't felt this level of frustration in some time, but this person has got this young Labrador Retriever, and the dog is overweight, and it's getting more overweight. And I'm talking to them about weight loss and nutrition and keeping their dog healthy. And I just could not create a sense of urgency in this person. You know what I mean? I sort of said, we need to work on this. And she kind of chuckled. She's really nice, and I really like her. But I felt like she thought, this dog is young. We'll figure this out later on. This is not the thing we need to talk about right now. And I kind of thought, it is the thing to talk about right now. And so let me bring this to you and say, Dr. Ernie Ward, talk to me a little bit about how you frame this, the weight loss conversation, and how do you create urgency around this so that people actually feel motivated? Because it's frustrating and challenging to feel like you can't motivate pet owners here.
Yeah, well, welcome to the last 25 years of my professional life. It's a series of ups and downs and frustrations in the moment. And the exam room is a perfect example of an area where, too often we're compressed with time, and then emotion enters into the conversation, and suddenly now we've lost everything. And This is an emotionally charged topic for many people. In fact, they feel judged, they feel in some way blamed. And those are all things that we have to, number one, acknowledge as a veterinarian, and then try to say, okay, how can we compassionately continue this conversation. And to that end, Andy, the first thing I've told everyone, and again, I'm not the first person to say this, but I certainly discovered it the hard way. You've got to have permission to have this conversation.
Okay.
I think that too often, as a veterinarian, we're used to kind of coming in and laying out the didactics. Your dog has a mass, there is a murmur, there is a pain in the joint, right? So it's very descriptive, prescriptive, and really unilateral. And when you get into topics like obesity, the first thing you got to do is say, is that something you'd like to talk about today? And so, and you've got to also be prepared, Andy, to accept that no, and sometimes it's a hard no, sometimes it's a rude no, but most of the time it's a soft, non-committal no. And so that's where you've got to also be nuanced, because what I find vets, when they say I'm frustrated with this, they typically are endeavoring into something that the client doesn't want.
Yeah.
Right? And so
I think you're right.
Yeah. So I think first and foremost, just to set the table, getting permission is where I start. And again, if you look at the psychology, the literature on this the last, 30 years with this topic specifically, especially in the human arena, that's going to be the first thing that everybody's going to say, get permission. So I typically, if I had that young owner with that young lab, I'm going to be like, hey, I am concerned about the weight gain. And there's a lot of reasons why, we want to make sure that we maintain a lean, healthy mass for your dog. Is that something you'd like to talk about today? Maybe we can talk about the food choices, the treats, exercise. Yeah. Is that something that you're interested in pursuing? And again, a lot of times, people throw their hands up and say, Dr. Ward, I'd love to, but I'm too busy today. Or I've got to,
yeah.
And that's a soft, non-committal. And I get it. And I say, no problem. I totally understand we're all busy. And then I usually will do that second nudge.
Yeah.
What if I send you something? We've got some great resources, some handouts. What if I just send you a link or two? And you kind of let it go where it lays. But I want to tell all of our colleagues, Andy, don't get frustrated. Don't take this personally.
It's hard not to.
Oh, of course. Back in the day, I was one of the first, me and a couple others were pioneering kind of what is now known as senior care. And this was back in the mid-90s. And I remember going to one of the big diagnostics company, and they were like, oh my gosh, this guy's got this incredible senior plan down there, and he's just, crushing it. And I remember going into this group of, academicians and a bunch of MBA types. And I remember going, okay, so here's our plan, and here's how we present it, and here's our outcomes. And I showed a chart that we had about 25% uptake. So that meant that about of the 100 folks that we said, hey, your dog or cat needs senior wellness, only about 25% took it. And you could just see these guys go, what? and so, what I learned, number one, was don't be afraid to swing the bat, because if you're not in the batter's box, you got no shot at ever hitting a home run or even a base hit. And the second thing I realized was that 25% is 25% more than the folks that never broached the topic. So getting back to obesity, that's how I've colored this conversation. So when people ask me, well, how do you accept all the no's all day long? I'm going, well, because I know that I get to a yes in somebody. The other thing is, you mentioned urgency. This is to me a dire, immediate need. Obesity is a disease. There are systemic inflammatory effects happening right now and will continue until we get down to, a normal level of adiposity or body fat. And so for me, as a vet, that's the personal part. That's the part that I have to let go of. Yeah. But I have to realize that, wow, I have to speak up and try to enter this conversation, or else I'm actually doing a disservice to my patient.
Yeah. No, so I love it. And I really like your framing of this, how you sort of mentally frame it for yourself. I think that's really valuable. I have not, that whole asking for permission is that I've got to add that to my game. I think that you're spot on. When you say it, my question immediately was, how do you take it when they say no? I really like your second nudge. I really like can I send you some information? I think that would make me feel good. And then also lets me send them over something that's sort of tailored to their specific needs. So I like all of that. I also really like your pragmatic approach to this of, I can't make people have this conversation. If I try to force the issue, I'm going to drive them away more than set myself up for future success. So anyway, you've already been a huge help here. When you get to sort of have this conversation about obesity, Ernie, how do you frame this conversation? What do you lead with here? Because there's so many reasons that weight control or weight management, weight loss are important for these pets. Do you have a go-to where you go in with lifespan? How do you frame that up so you can be impactful? Because you're really good at taking a short amount of time and making really strong points that people hear. How do you frame this?
Yeah, it's about quality of life. And, I've tried every tactic in the book. I've made up stuff over the years to try it. And, and I used to think that longevity, I mean, when people ask me, how did you guys get into obesity like this? It was because in my pursuit of longevity. I mean, that's one of the things that, even back when we started Project 25, which I still have the goal of letting the average life expectancy of dogs and cats become 25. So I think that's still realistic. Again, obviously breed exceptions, but so forth. Obesity is a way to get to longevity. And I thought that would resonate with pet owners, but it really doesn't. What I have found consistently works is quality of life. So now let's get back to that young pet owner with the young lab. See, they can't see the future. And so we have to frame it in something that at least they can relate to today. And so let's say that, again, it's a 3-year-old lab, and I see these all the time, just like you. And now it's 95 pounds, and that dog should be 80, 85 pounds. Let's just give him on the right side of the scale for labs. But let's say, it's 10 pounds overweight. That dog is perfectly fine to that person. It's running around, playing ball, hopping in the car, doing all the dog things that it should do. But we have to make sure they understand that it cannot sustain. And so often I would say, the person says, well, okay, Doctor, what do I need to do about this? Well, listen, what I love about, let's just say, Buster, for the sake of this conversation, what I love is Buster's just love of life. I mean, this is a dog that you can tell is enjoying every moment of every day. And my goal is to preserve that for as long as possible. And there's a lot of things that we can't see, but one thing I can see is that if he continues at this weight, and heaven forbid, if he continues to gain weight, that stops. And that is what I'm here to talk about. So I will typically kind of in my, Southern colloquialisms, that's how I'll kind of enter into that quality of life, right? Because look at how he is today. This will not be here. So you're kind of softly saying we lose all this, and now he's suffering. And I really do avoid, those terms, those triggering terms like suffering. I really don't even get into a lot of pain discussion. I just say, let's try to preserve this. Look how happy he is. He's loving life. Those are the little touch points I think that resonate with most folks. Now, obviously, there can be dogs that come in that already have symptomology, right? So now I've got a dog who has a gait abnormality, or maybe, again, they're tachycardic, or maybe they have tachypnea. I mean, all these things could be related to obesity. Or maybe I'm seeing a biochemical change, right? So on the lab tests, I'm starting to see some maybe liver changes or whatever. And those are areas that I'm going to dig into that comorbidity. But at the end of the day, for me, Andy, it's quality of life, because people don't really seem to care about adding another year or two to life, because they seem to think of, well, that's just going to be miserable, at the end of his life or whatever. They think of them in a wheelchair, and it's like, nope, let's try to keep these dogs happy and living the life that they deserve.
Well, I'm glad you brought that up. I remember when you were talking about the lifespan of 25, and that resonated with me, Ernie. Like I thought it was great. I was like, this is cool. Like the idea of my best friend living to 25, like canine feline, like I was like, this is great. And then it was just, I was curious what your response was, how pet owners reacted to it. Because for me, I was like, that's super motivating. And so just hearing that wasn't as motivating as you thought, I'm surprised by that. I just have to process that a little bit. But, I appreciate you sort of spoke to that, because I thought it was really sharp.
Well, and I appreciate that. And let me tell you, I think it was about 15 years too early. Because
you might be right.
Now there are drugs that are being trialed for this. So, I mean, we obviously have the Morris Foundation, which I'm a board member of. We're doing the Golden Retriever Lifetime Study. So, I mean, there's a lot of interest in it. I just think it was early, but I still think on the day-to-day, and again, when you look at the literature on the human psychology of obesity and longevity for human health, you clearly see a break. And most people, like, when you start saying, would you like to live to be 100, there's a big question mark over that, right? Because they're like, oh, because their perspective and experience with 100-year-olds is very decrepit, right? Yeah. And frail and fragile and really it's not a motivating picture. And so for me, it's like, okay, let's really roll this thing back into what am I looking for in life? And everybody will say, I want to be strong and viable. I want to be autonomous, independent. I want to be able to live on my own. And those are the things that we want to preserve for our dogs, because I will tell you this, there is nothing more frightening to most pet owners than an animal that cannot relieve itself. Now, I hate to be frank, but, we're talking to our colleagues on this podcast. And so, that is one of those things that quality of life, and obviously you don't lead it, paint a picture like that.
That's not your opener,
But the reality is, those are the quality of life deficits that really, that's what ends in euthanasia.
That absolutely makes sense. Okay. If you have a pet owner that's coming along with you on this journey and you make this presentation, what information are you trying to gather from them so that you can start to make a good recommendation? So they're open to hearing this. You've engaged them. All this talk about leading and really focusing on quality of life, that all makes sense. That's really super useful. And they're kind of nodding their head. My assumption is that you're going to start with sort of a bit of information gathering about how did we get here, what's going on. Can you sort of walk me through what that part of the process looks like?
Yeah, and that's a great question, because again, now we've got to get salient information that we can act upon or change. And so there's really three things that we're going to focus on during that brief time we have in that exam room. Mm-hmm. And the first is current diet, right? So what food are they feeding? And with today's therapeutic weight loss diets, the choices are, number one, expansive, but they are very, very good. They help with weight loss. Just this week, I was dealing with a veterinarian, and she was like, oh my gosh, I don't like all these expensive therapeutic diets. My clients can't afford them, blah, blah, blah. And I really don't have a good answer because, when you go outside when you start to restrict calories, remember, you're restricting all macro and micronutrients. So you can't just give a regular, complete and balanced diet and expect to maintain everything that you need. The other thing is the adjustments that we make in proteins and fiber, for example, when it comes to weight loss diets. So these therapeutic diets, you've got more choices than ever before, and they work, right? So I'm almost always, when that dog, that lab that you presented, that golden needs to lose 10 pounds, I am automatically now going to try to find a therapeutic weight loss diet for them. The second thing we're going to talk about is exercise, physical activity. And that's a minor player, and again, just going back to one of my first books on this in 2008, Chowhounds, and the literature, the research continues to hold up. The weight loss equation for humans and dogs, and again, our energy systems are very similar in many ways. It's going to be about 60 to 70% diet and 30 to 40% physical activity, exercise. For cats, that equation, though, is 90% diet and only 10% aerobic activity. And that makes sense because they use glycogen, they're anaerobic, blah, blah, blah. So, for me, the exercise and diet component is to help really promote lean muscle mass and to give some type of motivation. Because again, one of the things we're looking at is quality of life improvements. And if you can get that lab to lose 5 pounds, in fact, Alex Sherman's, one of my colleagues and dear friends from the UK, when they lose about 6% of their body mass, you see demonstrable improvements in quality of life. This is on a validated quality of life scale. So, again, several people have duplicated this research. So we know that they don't have to lose a ton of weight before the folks see, oh, they're better. And so this is why physical activity is sort of my hidden little way to get into that conversation, because suddenly now, 2 months later, 3 months later, that dog has lost 3, 4, 5 pounds. They're coming back saying, hey, things are better. I like this. And then the final part of the equation that I really need to uncover is treat behaviors, right? Because we do know that most clients are guilty of overindulging their pets. And usually, if you can just guide them towards healthier snack options, and this takes on a variety of different mechanisms. I mean, sometimes you can replace their treats with kibble. Sometimes you go to a different type of treat. I mean, you change the frequency, Again, dogs don't do division, so we break them in half. Mm-hmm. I mean, there are lots and lots of tools and tricks you can use, but treats are also going to be part of the equation. But, when people say, what do you do first? It's like focus on therapeutic diets.
Okay. That was exactly what my last question was going to be. So looking at these three things, they totally make sense. What's the current diet? What's the exercise regime? And then treat behaviors. My question for you is going to be, I'm sure it differs a bit with the pets, but how do you weight those? Do you weight those things? Meaning, if I come to you and go, well, yeah, we get some treats and we don't really exercise and we're not really feeding and we're juicing up the diet, in like adding extra stuff, sort of, like table scraps to it, things like that. I was like, how do you prioritize those in your mind?
Without a doubt, it's to get them on a therapeutic weight loss diet. And Andy, I keep going back to that because that's the foundation, right? That's the nutritional foundation, but also it's going to be the way to reduce calories. So even when I have those folks that are like, they're giving them pizza and ice cream, right?
Yeah.
I mean, but I'm not going to start that fight today because I know if I can transition them on the first step of the journey, which is going to be to change the diet, then I've got a better shot at the next step. And it may take months, right? And I'll tell you, a lot of times what you'll find is that these dogs and cats, they start on the weight loss journey. You switch them to a diet and, they're not kind of getting the results. And that's when you go to tier 2, right? And you go, okay, now let's talk about that pizza and ice cream that you guys have been sharing. Let's start cutting that out. But again, if you don't get them sort of committed and on a path, then you really, if you lead with taking away treats, I have found that is a definite recipe for failure, right?
Yeah, I'm so glad you said that. Like, you're blowing my mind. And like, this is why I ask you this, because you think about these things so deeply. To me, the ice cream pizza is like a waving red. I'm like, well, of course, that's what we have to work on. And this idea of setting them up with a therapeutic diet and then planning for the follow-up. Like, it's so much more subtle. You're saying this, like, again, this is going to be one of those episodes I'm going to have to sit and process just coming out.
Well, Eddie, let me go back and let me tell you how this whole ethos, and strategy came about, because, in addition to doing my vet work, I go back. I guess I got my certified personal training certificate in 2005. And so you're going through all these, and look, it's a whole different jam. So it's not being veterinary medicine, but, I have an interest, I'm a triathlon coach and all that stuff. So I've got interest, as you know, in that world. And so I'm listening to these folks, and, you start to realize that basically the human weight loss world kind of goes on two different tracks, right? And I call this number one, it's going to be the total, aerobic activity. So you exercise your way, you walk your way to weight loss, right? All that kind of stuff. So physical activity is the way. So they're in the gym and they're doing this and that, right? And the other is what I used to call the starvation deprivation track, right? So now you're going to eat, green peas and drink, lemon water or whatever, right? And I realized, wow, those are both bold choices and hard to adhere to. So I realized if I was going to take this to pet parents, I did not want to do starvation deprivation, and I knew we couldn't exercise our way to weight loss, right? And so that's where you kind of started to realize, okay, let's get back to foundational principles. If I can get them to take that first step, of just changing to a diet, and this is so easy because they buy it in a bag or a can, it's much easier than humans, then I've got a good first step. But if I lead with deprivation, starvation, removal of something, then I'm probably going to fail in more cases.
Dr. Ernie Ward, this has been fantastic. I really love this. Like, you're speaking my language. I've got real pearls I'm going to take away from this. Like, you've got so much experience and knowledge here, and you've thought so deeply about this. It's been really helpful. So I just want to thank you for being here. You are you're an educator. Resources coming out of this. Like, do you have favorite resources do you like to share? If we've got people who are veterinarians, technicians, they're listening to this, they're going, yeah, this is great stuff. What would you share with them, sort of keep them motivated to give them some more tools in their toolbox? What are your favorite resources out there?
Yeah. And again, I think the best place to sort of gather is going to be at petobesityprevention.org, right? And we also have the World Pet Obesity Organization as well, which is actually facing outward for the global community. But if you go to petobesityprevention.org, we have a monthly newsletter. We typically, talk about, hot topics in obesity, whether it's GLP drugs or new therapeutic weight loss diets. We try to keep folks kind of up to date on that. Also, of course, we do our surveys and our prevalence surveys every 2 years. So that's a great way to kind of get involved with that community. We continue to grow our efforts. Again, this is such an encompassing, broad topic. Let's face it, for me, this is the biggest health threat our patients face, without a doubt. We talk about dental disease, we talk about heart disease or osteoarthritis, but really, there's a much larger problem that, we need to discover a little more about. So obesity is really, so go to the website for sure. Obviously, we do a lot of outreach at different, all the major conferences. Typically, I'm there along with other board members, giving something. But, again, Andy, I think that the main thing I want vets to understand is that this is a disease state, no different than cancer, no different than being heart disease or osteoarthritis, right? This is a disease state. It deserves our attention. It does deserve our urgency. We don't need to shirk away from the conversation. We do need to get permission to start it. We don't want to get frustrated if we don't win every battle, if you will, or every conversation. And I do believe that we need to focus on getting those dogs on really good diets. And for me, if it's going to be weight loss, the conversation starts and ends with therapeutic weight loss diets. And, that's where I want to start. And then, we're going to hopefully end up at a better quality of life.
You inspire me. I agree. I love where your head's at. I am on board. Ernie, thanks so much for being here. Gang, thanks for tuning in and listening. Take care of yourselves, everybody. And that's what we got. Guys, I hope you enjoyed it. I hope you got a ton out of it. Thank you to Hills Pet Nutrition for making this episode possible. Thank you for Dr. Ernie Ward for showing some knowledge and some insight into a very important and challenging part of our job. So anyway, guys, I hope you enjoyed this episode as much as I did. Take care of yourselves. I'll talk to you later.